It is nice to see the faces. Usually we get a large Facebook following on our Facebook Live, but it is nice to see the faces in the audience and the people asking the questions. So thanks for coming out. We got changed the format a little bit tonight. It should make it easier for everybody to get their points made, and I appreciate your cooperation as we go through this. So, Captain Solo, if you will.
All right, thanks, Mr. Balkum. Okay, everybody, well, welcome to the town hall meeting. We have a lot to discuss, and we're really looking forward to updating you and hearing from you and answering your questions, providing you an update on where we're at and what we're doing. Since we last met, you know, we've done a little bit more in cleaning up the base and making sure that it's presentable. We are full into our holiday schedule and our holiday events. The next things that are coming up will be the Festival of Trees this weekend, so we're looking forward to seeing everyone there. As if that wasn't enough, the breakfast with Santa have absolutely been tremendous between the USO and MWR and the NEX. So we really appreciate everybody's strong support on that. Also, we're pushing really hard on communications. So if you're not getting the word on events or happenings, please, if you don't follow social media, the MyCFA Weekly. If you subscribe to the MyCFA Weekly, that will be helpful. If not, you could go to the CFA Facebook page or the Yokosuka MWR Happenings page, and that will also be helpful to get that information. A new thing that we've been utilizing is we have a podcast called Giant Voice, and that is also another way to get information. And that's really what we're trying to do, is we're trying to generate information. We are pushing as much as we can, and if you can share with us what's important to you, that will also be helpful. A couple items that we're working on right now. One is curbs. Some folks have come forward and said that, you know, as they're pushing strollers through the neighborhoods, some of the curbs aren't beveled towards the bottom. What we're going to be doing is we're going to be polling the individual communities and the neighborhoods to find out which ones you want worked on first. That way we don't start in the wrong spot and we don't put our resources in the wrong place. But if you guys could just let us know where we need to start, we'll be more than happy to do that, right, PWO? All right, that being said, let's get this slide presentation.
Good evening, everyone. Thanks for joining. I'm Commander Schroer, the Public Works Officer. So my one slide tonight is related to that topic. We're doing a lot on the base with traffic and parking and sidewalks. Many of that's from your feedback, and we continue to take your feedback for where to work next. So on Akego, we had some feedback that 2 crosswalks by Nara and Kyoto Heights. The crosswalk existed, but the conditions with kids running around and stuff and the visibility gave some parents some concern. So we've come up with some solutions to improve those crosswalks. One of them is to be a stop sign, the other is some fencing to kind of serpentine the pedestrians where you can't just run in the street. We're also adding a stop sign as you exit the main gate that was requested by the community, as well as 3 speed reading signs, just like you on main base as you enter Gridley Tunnel, you see it tells you the speed as you're driving. So it should remind people as they head down the hills in Akego to slow down and prepare for the intersections. On main base, Nimitz Drive, you might have seen this week, we're finishing it next Monday. Nimitz Drive is being restriped. That's going to extend the length of the 2-lane traffic, make some of the work easier for our security department as they make that incoming in the morning and outgoing in the afternoons. So you should see a slightly improved traffic flow there with the new markings. We're also looking at Gridley Lane by 4th Avenue and taking some feedback from the community on difficult visibility around the corners at that intersection. That's in the bottom left there. It's not a 90-degree intersection, so it makes it a little challenging to see, and we're putting together some improvements for that. Finally, not on this slide, we have $2 million of paving and restriping happening this year on the base, and we have all those areas marked out for the contractor, and so you'll see a lot of areas, a lot of parking lots get repaved, especially along Clement Drive, which is by PSD and McDonald, that drive there. You're going to see new paving there with new crosswalk striping and turn lanes, so it should improve the traffic flows, as well as several of those parking lots like PSD and the Galley in that area. Finally, I'll put out our trouble desk number, so as we get this community feedback, there's many ways to reach us. The best way to have a facility repaired is to call the facility trouble desk. So that number is 243-5555. From a cell phone, it's 046-816-5555. So if something is broken on the base, especially if it's in the public area where maybe no one's looking, like a gate or a fence, that's the number you call, and we will come out and repair that location back to its original condition. So thank you for that feedback and helping us know where to work. Appreciate it.
Good evening, this is Lieutenant Commander Beener. I'm the Acting Fleet and Family Readiness Director, which encompasses 3 major departments that impact the community. Those are our Fleet Family Service Center, Morale, Welfare, Recreation, and Housing. First thing I want to talk about is trying to re-energize the community and apply some upgrades. So, as you can see the list up here on the left, Commander Nagiri in Japan has several upgrades or renovations that we have not executed in some time from a host of reasons. So we have cash, but we have to figure out where we want to spend that money that's going to best suit the community. So since 2020 with COVID, and we just had very limited upgrades or renovations applied to the community, and with Captain Sobel and the easing of the restrictions and Captain Sobel coming into command, this has been a mandate and a big push for us to be able to find those areas that we can improve within the community that's going to make the biggest bang for our buck, so to speak. So we're really interested in finding out exactly what you're interested in and what would best suit or best serve the community. The big 3 that we're always looking at are fitness, CYP, and the clubs. And if you've been to any of our clubs, they could definitely use some refurbishing. So if you have suggestions, please ice them to us. It's the easiest way for us to get it. We read every ice comment. If you leave contact information, many of you don't, but if you leave contact information, it allows us to better follow up and ask specific questions. Some of the things that have been earmarked for renovations that haven't been executed as far back as 2009 are listed there on your left. So really, I need your feedback from the community so I can best put my efforts where they're going to best serve you. So please shoot me a nice comment, and we'll be able to figure out where we can apply that. With all things, it will take time. We are a bureaucracy, but we will definitely put a lot of pressure there. All right, for N91, Work and Family Life, there's no AOB the week of 26 December and 2 January. We will resume 10 January. We're going to add, one thing that's not up there, we're going to add a housing aspect of that. Today I went into the AOB after the CO and the CMC talk. I polled the room and I said how many people are brand new to Japan. About 2/3 of the room raised their hands. I said how many people here would appreciate having some of the housing process explained to you at AOB ICR, and about half those people said that they would. So we're going to implement that. Esteban and Ms. Stephanie over there, they're going to work together to get that in the AOB ICR starting at the latest 10 January. To add to that, sponsorship training, because your sponsor should be helping you with this, sponsorship training is going to be held 21 December at 0900. Please register if you're a sponsor within the command, or if you're a sponsor coordinator. Please get your sponsors to this training, because they should be handling things like this is the housing process this evening. Some kudos out there to Ms. Stephanie. She's done a really good job of pushing to hire clinicians and get the staffing levels back up at Fleet Family Service Center where they need to be. She's really, I'm serious, she's hired, what, 6, Stephanie? About 6 clinicians in the last couple months. So because of that, and because of her efforts, non-medical clinical services are resuming at Fleet Family Service Center starting 10 January. Child clinician accepting referrals now, which has been something that's been hard to come by. And then the MFLAC, we have an MFLAC that's at Fleet Rec, room 347. She's prime located there for people that are on the waterfront, and she's extended her service through 24 January. Finally, the airport shuttle, CFA airport shuttle, pre-registered house guests that may be visiting for the holidays must be escorted by the sponsor while riding the shuttle. You'll also see these QR codes and this particular sign posted up throughout the base. If you snap on that or use the QR code, it's going to allow you to provide feedback to Fleet Family Service Center so that we can adjust our services to meet the community needs. So keep your eye out for those, and if you see them, please, if you have a suggestion, that's an easy way for you to get a hold of us. All right, moving on to MWR. Festival of Trees, December 17th and 18th at the C2 Auditorium. A bunch of New Year's Eve events at Club A and Club T. January 5th, there's a comedy show. January 11th, Drew Hill concert. I'm hearing rumor that a top 40 band that's maybe playing in Tokyo at the end of March is looking at possibly coming down here to CFA. So once we firm that up, we'll go ahead and we'll share that information. Fitness equipment, $250,000 was given us by Region to refresh a bunch of fitness equipment in Purdy. And we're also going to look at trying to replace some of the carpet and the paint and move out on some of those renovation projects. The theater update. This theater is a prime example. We've got a requisition in for a brand new projector, which will bring this theater back online and able to service the community. And then one thing that's on here that's late breaking, the CDC policy prior to the Child Development Center's policy prior to this afternoon was that if you are an infant or a toddler, pre-toddler, 2 years or younger, and you were a close contact, meaning the person that was working in your room as your teacher tested positive for COVID, all those infants had to go home because they couldn't wear a mask. We reviewed the Center of Disease Control policy. We reached out to other CYP and CDC programs throughout the region. And based on that feedback and based on reviewing the policy, Captain Sobel has softened those restrictions. And so now if your caregiver or somebody in the room tests positive, the infants and the pre-toddlers are going to be able to stay there, but we're going to increase our sanitation measures by increasing the social distancing, sanitizing, checking for symptoms more often, so we can catch anybody that's positive if it's spread earlier. This is going to be a huge relief to your sailors that have to, or even the workforce, that have to stop work because their kids are not allowed to go back to the CDC for 10 days. So that's been rescinded as of about 15:30 this afternoon. And everybody at the CDC, if your children are at the CDC, they should be getting that message shortly. For more information on the MWR programs and events, visit the MWR Yokosuka page, or you can go to the Facebook page. All right, housing. So there's a couple projects coming up. We still are replacing the fencing and the privacy type for the main base, 82 townhouses. The estimated completion is September of 24. Whole house renovation at KEGO, 96 townhomes will come back online sometime in the future. They're funded for November 2022. Whole house renovation for KEGO, 24 townhomes for phase 1. The kitchen should be completed by this coming summer, and they'll be opened back up for the surge for the PCS season. So it should open up some of those townhomes out in KEGO and help out a little bit. Christmas decorations, 30 days prior, 15 days after Christmas. So please take them down. We're not living someplace where we can have them up year-round. Disposal of Christmas trees. Tower residents place the trees in the dumpsters enclosed area. Townhouse residents place the trees next to individual trash containers. Limited services during the holidays. In observance, the MLC employee holiday period, the Yokosuka Housing Service Center in KEGO will have limited services from 29 December to 3 January. And then one last thing I wanted to bring up is that we're going to have a contractor will be representing the child safety assessment for military family housing from 9 to 20 January. So we'll make sure there's going to be about 280 units that'll be assessed. We'll give you plenty of notice. It'll take about an hour. They're going to come in and they're going to look at your windows. They're going to look at smoke detectors, CO sensors, the water temperature, things like that. So you'll be notified about that. And then we'll share all this information again at the Y Club. Thank you.
Good evening, I'm Dean Land, the Director of Installation Staging for CFA. All right. So, holiday gifts. If you're planning on getting your children a bike or a scooter, please be reminded that helmets are required by everyone riding a bike, scooter, skateboard, etc. on base. That also includes it needs to be buckled, so that it doesn't come off. We see a lot of people that are riding without them or that have them undone, so we keep stopping them, but just remind your children that they need to wear them. That does protect them. Also as a reminder that all electric scooters, skateboards, etc., if they're electric, they're not allowed. You can have an electric assist bicycle, but you cannot have a scooter or a skateboard. And we are getting more information on areas that are bringing those in. I think Japan is working on making it easier to get electric scooters. As we get more information from the Japanese government, we'll put that out. The next slide is, we've changed the hours and the requirements for the licensing. It is now walk-in only. There was a Facebook post that had a phone number and email address. Those are not actually monitored anymore. So if you need to get your license done, you can just walk in and ask them for that. We are closed for the Japanese holiday, so they will be closed at the end of December. So please make sure that you plan for that. And if there's any other questions, you can reach out to my office with a nice comment, or you can call us and we'll be happy to answer them as quickly as we can. Thank you.
Good evening, CFA. I'm Chief Davis, Operations Chief of Security. First, I would like to thank the community for all the feedback. It actually is super helpful in security to concentrate our areas of focus. So please keep the suggestions coming, and we'll do the best to meet those recommendations and serve the community better. So our ongoing areas of focus are abandoned vehicles and bicycles. Year to date, we have impounded junked 70 vehicles. So a reminder, your vehicles are subject to be towed if it's illegally parked for an unreasonable long period of time. Remember now it's 3 days, so if it's been there for 3 days, we do have the authority to impound and then junk it 3 days after that. Also, if it interferes with traffic operations, creates a safety hazard, is disabled by accident or incident, and is left unattended or adjacent to a restricted, controlled, or off-limits area, and what we see a lot is abandoned vehicles. So also too, as I mentioned, the bicycles, we've been enforcing that as well. So year to date, we have impounded junked about 143 bicycles. If you see any bikes that look suspicious or that possibly need to be junked or impounded, please call a traffic code at 315-243-3650. So our future areas of focus will be school safety and drunk driving enforcement. Reminder again, in those school zones, the speed limit is 20 kilometers per hour. Also too, be mindful, you're not allowed to be driving on the phone, driving and speaking on your cell phone. Please don't do that. And we've also been seeing people driving pretty recklessly with the school children walking across the crosswalks. So we'll be on the lookout for that as well. Please do not do that. And it's the holiday season. Do not drink and drive. We will be making a concerted effort to enforce DWIs and DUIs. Thank you.
Good evening, CFA. My name is Lieutenant Taylor, the Emergency Management Officer here for CFA. So from the EM department, we just wanted to reiterate the Emergency Evacuation Program preparedness. This is a USFJ requirement for all SOFA members to have their packet on hand and ready to be executed at a moment's notice. We do hold monthly trainings the fourth Monday of every month. For the month of December, we will not hold our trainings due to the holidays. However, the next session will be the 23rd of January. So if you have questions, hopefully you've seen your packet and it hasn't collected dust a little bit, but in the event that it has, this is a perfect time to come out, get specific training from our EM staff, and we can answer any questions, making sure that you all have your paperwork ready to go in the event we need to initiate any type of evacuation. So for any questions, our contact information is here, the email and phone number is up on the screen. Thank you.
Hey, good evening, everyone. My name is Chaplain Dave Kim. I'm your friendly neighborhood chaplain. And it's a busy time of year, the holidays. I'm all about Santa Claus and holiday shopping and Will Ferrell, just like everyone else. But it is also a time of religious observance for many of us on CFA. So the chapel is extremely busy. So here we have a kind of a schedule of some of our main religious observances this coming holiday season. We also have a Jewish community on board that does not currently lead a service, lead a community that meets on base, but they have asked me to forward the invitation. Many of them do worship together at the Jewish community in Tokyo, Jewish community of Japan. And so on the lower right is the information there. They will be observing Hanukkah together. It is an observance that will require future registration ahead of time, so please visit the website at jccjapan.jp if you would like to join them for worship there. The Jewish Welfare Board also has resources online, and that's available on the slide as well. But if you would like to volunteer and help out with leading a service, leading an observance, please contact us at the Chapel of Hope. We are always looking for religious lay leaders and volunteer worship providers to be able to help us at the chapel provide for just the diverse religious needs of this community. So thank you for that. All right.
Good evening, Yokosuka, Keiko Communities. My name is Daniel Miller. I'm the postal manager for Yokosuka and Keiko post offices. On this side here, you can see we have the mailing dates for priority mail, express mail, and first class letters. So, first class letters and priority mail, that has passed as of last Friday. This Friday is for express mail to make it back to the States for all your express needs to get back for your family members for Christmas. Here's our calendar that shows our holiday hours for while we're open. We open on 08:30 to 1700 for package pickup, finance 08:30 to 1600, and for on Saturdays we have parcel pickup 08:30 to 1700, finance 08:30 to 1600, but there's a little asterisk there, which is your click and ship and prepaid only that we can accept. And then you'll see on the right side of that slide where there's a little asterisk, it says normal hours will resume on the 27th of December. So our hours are going to be Monday through Friday for finance from 09 to 1600, package pickup 09 to 1700, and on Saturdays, this is going to be the more significant change. It'll be package pickup from 1000 to 1400. G59, which is next to the food court, we have the parcel locker annex. There is the prepaid drop-off, which is a primary point for anybody that uses prepaid click and ship. They can go there and drop off and not wait in any kind of line at the post office. Also, Monday through Friday, and that's open from 08:30 to 16:30. Check-in and check-out service, Monday through Friday at the customer service window, 10 to 13. Next slide. You can see right here we have some priority rate mail increases that's imposed by the USPS from the 2nd of October through 22 January. It's based off of zones. So you have zones 1 through 9. Zone 1 through 4 is, if you're in the U.S., is between 1 to 600 miles. With zone 5 through 9, it's 601 miles to 1,801 miles or greater, which will determine. So as an example, if you're shipping something here from Japan and it's going back to anywhere on the West Coast, which is California, Seattle, you're sending anything, Washington State, those areas along the West Coast there, those are all considered a local zone, which would be zone 1. So, and if it's going all the way to the East Coast, those are going to be a zone 9. Anything that's Midwest, depending on what the actual zip code is either zone 4 or zone 5. It can vary based off of what the zip code is. So you can see the rate increase for priority mail, express, flat rate boxes, and envelopes. So if it's zone 1 to 4 and it's less than 10 pounds or less, it's a 30-cent increase. If it's zones 5 to 9 and it's 10 pounds or less, it'll be an additional $1 increase. So some of you, if you actually utilize the online service, there's other outlets out there other than the USPS Click and Ship, but I know if you're using some of the other ones, it'll annotate and it'll show you that breakdown of the additional fee that you're being charged for the October to January time period. If it's 11 to 20 pounds, zone 1 to 4 is 95-cent increase. 11 to 20 pound for zones 5 to 9 is a $3.20 increase. And if it's 21 to 70 pounds, which is the maximum weight, it is $3.25 for zones 1 to 4, and $6.45 increase for zones 5 to 9 from 21 to 70 pounds. Next slide. Okay, this one here, talk about global trade compliance. What is GTC or global trade compliance? I know a lot of people have questions on that. This has come down from the United States Postal Service through MPSA, which is the Military Postal Service Agency. They have now, that is combined with USPS, U.S. Postal Investigative Services, Department of Homeland Security, and Customs and Border Protection. When it comes to with that, what they're doing is USPS mandated back in 2015 to go electronic with the customs forms. And that was, I guess, moving forward towards this global trade compliance. By them doing that, everything can be managed and monitored back in the United States. Even though when we ship something out and it's leaving at a domestic rate, because we're getting charged at the domestic rate, like as if we were in the US, when we go to ship something out, now with this whole global trade compliance, you have to be as descriptive as possible on what is on your customs form. Even though we're getting charged at a domestic rate, our mail is still considered international mail. So anything going from overseas into the U.S. falls under global trade compliance. Anything coming from the U.S. going overseas to us does not fall under global trade compliance. So something on here where you'll see when they're talking about a vague description, you might see that on a package that's coming to you here overseas, because they're not worried about what is leaving the country, they're worried about what's coming into the United States. And that's what all of this global trade compliance covers. So for us to be able to actually process and dispatch your mail, when we go to scan it, we have a system that we have to use. We scan it, and if it pops and it gets, there's different codes that we're going to get. We have H1, H2, H6, and a BD. Those codes represent different things. So we cannot dispatch your mail if it has one of those codes. Sometimes those codes is just the fact that you may have done the transaction online and that information hasn't transferred over to the USPS system yet. Sometimes we've even had it where customers right there at the service window, they get financed right there at our counter, and then we move it to the next station that processes our stuff for dispatch, and it could have been maybe 10, 15 minutes and it was done in the USPS system, because that's what we use, and it'll get one of the codes to where we have to wait and hold your package because it's waiting for the electronic customs information. It hasn't transferred over yet. So that's where this whole global trade compliance comes into play. With that, you always want to be as descriptive as possible on your customs form. Yes, we understand it's the holidays, it's Christmas time. Everybody wants to, not list what we're actually mailing because, we got little ones that can actually read and they're going to see what's on the customs form when the package comes, when that package arrives back home in the States. So, but you still need to be as descriptive as possible on there. And we've listed, as an example, 2 shirts, 1 pants, 5 bars of soap, etc. There's also some listings here of common vague descriptions that's been provided to us from the United States Postal Investigative Services. So when you see clothes, electronics, gifts, household items, household goods, medicine, merchandise, toys, food items, sporting goods, those are all vague descriptive items that will get flagged and we cannot dispatch your item to go back to the CONUS. Then there's process that we have to go through. If it doesn't clear, we have to request for clearance. If it doesn't clear, then we're going to get a status given back to us that tells us we have to return it back to the shipper. So if that happens, we've been instructed from our headquarters, not headquarters here, MPSA headquarters, which once that's happened, we cannot refund that money. So that's why it's very imperative that be as descriptive as possible on your customs forms. And then also here's some of the list of some of the non-mailable items: alcohol, cigarettes, cologne, perfume, hand sanitizer, vaping items, airsoft paintball guns. Those are all non-mailable items. So please do not try to send it through in the mail. All the mail gets x-rayed. Once we dispatch it, it'll get airlines also x-ray and look for that type of stuff as well too. And if they see it, they're gonna pull that out, and then that'll get sent back to Yokohama, and then we have to reach back out to you to have you come claim your package back and remove the item so then it can go back out. So that'll create significant delays. Next slide, please. All right. Customer service hours. So effective 27 December, we'll go back to our normal service hours. Finance, Monday through Friday, 9 to 1600. Package pickup, Monday through Friday, 9 to 1700. Saturdays, 10 to 14. That was the one that I mentioned earlier about a significant change. Also notice the asterisk on the Monday through Friday, because on Thursdays, we close every Thursday for training at 1600. So that way we can conduct postal training and in-rate training for the military that are working there. Do be aware, yes, after we close, you may get email notifications for a package to pick up, because once we close, they're cradling all of our handhelds and all that, so things are gonna upload. And we may have already done an upload prior to closure, and it takes a little time for the upload to go from us to the server in the US, and for that to come back and send out the email. So don't think we're just back there stowing the packages when we close after that time. No, we're actually holding postal training and in-rate training, because for a lot of the people that are not aware, postal has now transformed from the logistics specialist rate to now it's the retail services rate. So now RSs are working in postal. And this is something that they have never done before, so the training aspect is a very crucial part. So this is going to be brand new for them, and it's also going to be on the rating exam. So that's why we're closing on Thursdays at 1600, so we can conduct this valuable training. G59 prepaid drop-off, Monday through Friday, 0830 to 1630. And as I mentioned, it's a primary drop-off for prepaid. You don't have to come to the post office to drop it off, especially if you know that there's any type of line over there. Very well, you can go to G59 and drop it off. You come in, drop off your package, show your ID card, and my clerk's gonna just verify the information that's on there, looking for the GTC compliance on the customs form. If everything looks good, you should be in and out in a matter of 1 or 2 minutes, depending on how many packages that you guys have to ship out. If you do happen to come to the post office, if you've done the prepaid and you wait in line, you should hear our clerk should call. Next prepaid, first class stamps, postage, letters, and money orders. Those have head of line priority. We can get those in and out in a matter of a couple minutes. Those that have done the manual customs forms, you will just have to wait a few if you're like the next person in line, because the electronic has head of priority. So that way, if you're there at the main base post office, just be aware of that. So please pay attention when we're calling that out, because if you did do the electronic customs form, we do not want you to miss your head of line privilege. Check-in, check-out services, Monday through Friday, 10 to 1300, and then we are closed on Sundays and federal holidays. At the bottom of the slide, and on all of those slides, you'll see the email address, Yokosuka Post Office at fe.navy.mil. That is the primary email address. If you have questions or inquiries of any type, please utilize that address. There used to be an old address that was like MTAC-YO, Yokosuka Post Office, TAC-GS, TAC Post Office. I mean, it was like a mile long. That one has been turned off. So if you try to utilize that old email address, nobody is monitoring that address. This is the primary email address, so please use that. We also have QR codes posted throughout the facility in the post office, so that way if you scan that QR, go ahead and hit it, and that'll automatically populate to send the email. So please utilize our new address, or you can give us a call at 243-5486. Okay. Next slide, please. Yep. Effective 1 January 2023, to help streamline our process, the Yokosuka and Akego Post Office will no longer accept cash as a form of payment. All acceptable form of payment will be made via debit or credit card. Up here on the slide, you'll see these are all acceptable forms of payment. American Express, MasterCard, Visa, Discover, Apple Pay, and Google Pay. So yes, you can use that right there. We've received new credit and debit terminals from the USPS. So if you got Apple Pay or Google Pay, you can go ahead and scan it with your phone and all that type of stuff, and it'll process and it'll go through. So this is a shift from our headquarters, MPSA, Military Postal Service Agency, to push for cashless payment operations across the Navy and the globe. As a cash-free location, the base post office will improve service levels by reducing transaction times, resulting in shorter waiting periods in the lobby. And I know the biggest concern, everybody, is going to be money orders. Money orders can still be purchased, but can only be purchased with a debit card transaction, cannot be used with a credit card transaction per the USPS regulations. So again, you can use debit card for purchase of a money order, no credit card. And again, we have the email address on the bottom of the slide, so if you have any questions, go ahead and email us, Yokosuka Post Office at fe.navy.mil. Thank you.
Before we bring the hospital up, ma'am, I'd like to give the commissary an opportunity to address the group.
Good evening, everybody. I'm Bill Hicks from Yokosuka Commissary, excuse me. I'm the Assistant Store Director, and I'd like to inform you about our YES program. It's from the variable pricing program that we have going, where the commissary has decided to go ahead and take 3 to 5% off to help shave the recent inflation where we've been feeling, as well as some items are getting as much as 25% off. And before it was known as early bird, we've gone and made it permanent. Normal business hours are from now on 8:30 to 2000 hours, Monday through Friday, and 9 o'clock to 1900 hours on Saturday, Sunday. And you've all heard that we have Click to Go, which is online shopping. You can use your Star Card now to make your purchases. Also, we're doing, as in the future, we're trying to do delivery, and that would be Ikego only. It's called Click to Go Drop, and it's almost complete, but we're coming up with some software problems through IBM. So that's kind of on hold, but that's coming. And this is for any units that, or organization that wants to understand better how the commissary works and all that. You can come see me, and we can do an after-hours event with you. That would be after closing 2000, and we would have refreshments, games, quick tour of the commissary, and answer any of your questions, and even some demonstrations such as how to make sushi. Anyways, thank you.
Good evening, everyone. My name is Captain Jenny Riquette. I'm the XO of the Naval Hospital, and I have a few things to share with you. The first is that our commuted tomography scanner is brand new at the hospital. During the month of November, we installed, or GE installed, the CT scan machine, and it took about 5 weeks total. The CT technicians have been trained, and we're excited to have this brand new state-of-the-art technology installed in our hospital. And then additionally, over the last few months, we have made significant gains in our active duty and beneficiary access to care. We still recognize that we need to adjust the pediatric enrollment. So what that means, empanelment, it means that the number of patients per provider needs to adjust. And so we're working on that now, and people should see changes in the month of January 2023. And for the next slide, we are changing our COVID vaccine to Moderna only for those ages 5 and up.
and that is due to the shelf life of Pfizer and the demand for the COVAX vaccine in the first place. Pfizer is only good for 9 weeks after it's defrosted. Moderna has a much longer shelf life, so starting in January, we will only have Moderna. And then additionally, we anticipate the Joint Commission accreditation body to come and inspect our hospital sometime in January or February. This is usually a triennial survey that all hospitals in the DoD and in the United States go through. Ours was delayed due to COVID, and some of our partner services in the Army and the Air Force have had their surveys in the month of November and December, and so we anticipate that we are next. What this means for you is that we are accredited by this organization and that we are providing the best care possible. And then hot off the press today, we have some new information about the flu vaccine. We discovered that there were about 170 school-aged children who had not managed to get the flu vaccine through our Shotexes. And so on Friday of this week, we will have an all-day opportunity for walk-ins for the flu vaccine for those school-age as well as CDC students. And then next week, we'll start having some appointments each day for the flu vaccine for all types of patients. That's all I have. Thank you.
Okay. Appreciate all the service providers providing us the details of information for the things coming on in the future. So now we're going to move into our questions session. So what we'd like is members of the audience who have questions to come to the podium, give us your name and tell us what command you're with, and ask your question. And we're standing by. Would anybody like to be first? Please, come to the podium.
Hello?
Go ahead.
Hi, I'm Natalie Tillman. I'm a dependent active duty. I had 2 questions, if that's okay.
What's your name and what command are you with?
Natalie Tillman, my husband is with Naval Yokosuka. It's like off base. It's shore duty.
Okay.
Previously, at the town hall meeting in September, it was stated that 2 temporary dog parks would be constructed, one by the end of October, the one currently available, and a larger one soon afterwards. Pet owners with larger dogs find the current dog park too small for them. It also has no sectioned areas to separate dogs by size or, more importantly, temperament. What information could you release at this time to address these issues and concerns from pet owners, as well as disclose any information about the brand new permanent dog park stated to be ready by January, such as its location, size, or special features?
All right, thanks for your questions. Commander Schrar again. Yes, we did open a phase 1 of the dog park. I think it was October. The rest of the dog park will be very similar to the previous one in size. It will have a large dog area with a separate small dog area co-located. Its location is actually right next to the current one. So it's by the NWR building out by the field. It will be completed by end of January. So we've got the parts on hand. You'll see work on site currently. They're grading the area. They're removing some concrete structures that were in the grass. So work's ongoing now. Materials are on hand, and it'll be completed by end of January with the final park, which will look in size and type, will look very similar to the previous dog park. Thank you.
And the second question?
Okay.
The pet policy continues to heavily impede the few CFA approved pet sitters living in military housing, limiting services for military members or dependents. As pet owners face difficulties coordinating pet care, especially during the holiday season, what future plans or discussions have taken place to improve the kennel on base, such as expanding the facility, hiring more staff members, or offering volunteer work for those interested, similar to the post office?
All right, thankfully we had PDX is here, and they handle the kennel operations, so I'll let the PWO.
So we are developing options to expand the actual facility, and that's what I'll talk to. I actually have a brief with the CEO tomorrow on what facilities we could actually do that in. But we are currently, I think we have 8 or 9 large dog kennels, and then several more small dog kennels. And we're looking to grow that significantly, maybe up to 50%. And I'll talk about their operations here with Charlene for the next.
I'm Charlene DeBose, I'm the general manager for the Navy Exchange, and we currently contract the kennel that we have now. We have a team from headquarters flying in at the end of January to discuss a future kennel operation, and we're looking to expand services. What I'd really like is feedback from the community on what services you would like. If it's expanded grooming, is it daycare that you want? If we can get that feedback, that will help us build the type of business that the community needs. Nexcom is looking to expand this CONUS. It's not currently a business that they're in, so we will be the prototype for that. So all feedback is welcome.
I wanted to take this opportunity to thank the leadership for all of the guidance and resources that has been made available to the pet community and for the opportunity to have their voices heard. Thank you.
Thanks. All right.
Good evening, my name is Bush. I'm a contractor on base. My concern is the waterfront. I'll start off with right over here on the corner of Decatur and Morrell Street where it intersects. Heading west to east, there is no stop sign. It hasn't been there for quite a bit. That's because the old street used to be one way heading east to west.
I see. Are you familiar with that area? PWO?
Sure. So, Commander Schrar again, I'd be happy to look at that intersection. If there's a missing stop sign, we can absolutely put in a service request. Again, 243-5555 is the best way. Any way is okay, but this really helps because we don't know where to find the broken things until people tell us. So I'd be happy to look at that. If there's a missing stop sign, we'll fix it.
All right, thank you, sir. My second question has to do with, we talked about marking the areas. Is that including parking lots? Like right over here on the Fleet Theater parking lot, a lot of the lines have disappeared over time.
It does. So what I mentioned was we have a $2 million task order this fiscal year that will be awarded, and construction will start late summer. Actually, the Fleet Theater is one of the areas being, I'm not sure if it's repaved and restriped or just restriped, but there's several parking lots and streets, and Fleet Theater is one of them, as well as I mentioned, on the community side, behind the PSD and McDonald's, the Galley. So there's several lots, the Juban Tower area. So there's several lots, again, either restriped or repaved and restriped, depending what they needed.
Thank you very much for your answer, sir. Would it be possible to talk to you after this meeting about another situation?
Absolutely. And as that project develops, we'll publish with PAO and through Y Club and other means, and future town halls, we'll publish the actual maps where those are. But we're still a good 7 months out from seeing that construction, and so we'll publish that before it's happening.
All right, sir. Thank you very much for your time.
Okay. I think we have another person approaching the podium.
Good evening, Paul Velasquez from SRF, new employee here. Just want to bring up a couple of things with medical that I can go offline with for temporary duty medical requests for referrals off base installation. Just trying to address what's the common policy and procedures for either the sponsor or family members that need referrals off post, and I take this offline. One other issue is recently for the non-patient care for non-retirees or active duty military, is that going to be relooked because it's making a kind of an obstacle for licensing, for example, and getting medical certification for those with disabilities? Is that going to be revised with the new COGNAV instruction 5800-2-golf for the portion of medical certification.
I'm not familiar with that instruction, so I can't speak to that. For medical, for your first question, you talked about medical for contractors, and so the space available policy remains the same as over the last couple of months. We have no space available in pediatrics and internal medicine and in family medicine. And so folks who are not beneficiaries in TRICARE should seek care in the community or through a U.S. provider. And I can talk to you offline about the instruction. I might need more clarity on that.
Okay, thank you.
Yes, my name is Sydney Robbins. I'm with Puget Sound Naval Shipyard, PCS engineer here, and my question is also pertaining to medical. So my first question pertains to publications of Space A appointments. Some people might be aware Camp Zama is daily posting at about 0900 the number of Space A appointments that are still available any given day, and allowing an opportunity for those of us who are not otherwise allowed care to take those appointments so that they don't go unfilled. It was recently highlighted too that by doing so, Camp Zama was one of the most efficient military treatment facilities in Japan, and so I'm just curious, is the U.S. Naval Hospital Yokosuka planning on doing that as well, and if not, why?
Right now, we don't have space available to advertise, so we are not advertising it. We have discussed when we do have space available what that process will be, and have deliberated different COAs for communication with the community, and not decided on one because we, as of yet, do not have space available.
Thank you. My next question has to do with some prior statements that specialty care would still be made available to civilians, as it is in many cases still largely more space available. However, myself and others have found that when we try to make those appointments with specialty care, they require a referral from a U.S. doctor. We cannot get the referrals from primary care at the hospital. And when we try telehealth routes, we have been, everybody I know who has tried, and pulling the community, have been unable to successfully receive telehealth medicine through their insurance providers because they're not receiving the care in the state that the provider is representing. Essentially, it is not legal for them to provide medical care for us while we are overseas and not in a state that they are representing. So is there any intent from the hospital to, I guess, perform a bridging action for some of that specialty care where we can't get the referral to fill those appointments?
At this time, no. The specialty care that is most available is the health promotion specialty care. So for well woman, well male exams, mammograms, things like that. For surgical services, specialty care, people often access that through the ER when they break a bone would be a common example. And so those services are still open. But yes, we recognize that there may be difficulty accessing them.
It's more than just difficulty, it's impossibility. Again, for myself, and I mentioned it at the last one, it came down to an issue of trying to reschedule a CAT scan. And it was completely barred, short of going through some extraordinary means, which are not necessarily going to be a long-term solution for people, you know, and needing care like that for things like renewal of birth control. I just want to make it clear that currently we can't actually access that. And I guess my third question pertains to prescriptions. I hear a lot about how we can still fill prescriptions at the pharmacy as long as they're prescribed by U.S. doctors. However, in general, U.S. healthcare providers, even if you had a primary care physician back at home, legally cannot prescribe you medication if they haven't seen you within the last year. A lot of people don't have RAT travel or home travel that they're allowed to take annually. I know Dodea, it's every 2 years. Telehealth, again, also will not prescribe regular medications, things like birth control, anti-anxiety medications, blood pressure medications, many of which cannot be found out on the economy. I know, for example, my birth control I've been taking for almost 15 years is not available out in Japan. Is there any acknowledgement of that and perhaps a bridging care being offered by the hospital for things like prescription refills, prescriptions that have already been filled at the hospital that have run out of refills, that we can't get the refills because we can't see the hospital physicians.
We still encourage people to seek care in the host nation through their insurance or through their U.S.-based providers. We recognize that the solutions that we've presented may not work for everyone. And we are part of a larger collaborative to try to find the long-term solution that will ultimately fix care for all the 4,000 civilians that are in the Yokosuka area. At this time, I do not have other recommendation for you.
Understood, thank you.
Hi, my name is Amber Malone. I'm a Dodia teacher, and I also have a medical question.
Perhaps I should just stay up here.
We got a chair.
That's all right.
So I have a couple questions in access to care issues. Obviously, we know that this is a long-term challenge that needs to be addressed, and we know that there are people looking at what are the long-term solutions. In the short term, as Sydney already mentioned, there's a lot of things that people are running into with just access to basic prescriptions, lab work. Telehealth is not an option. Most of our insurances, there is a stateside telehealth and a global telehealth, but Japan is on a list of countries that those telehealth providers cannot provide prescriptions to. So they can only provide general, like, over-the-counter recommendations and things like that. They cannot prescribe any medication, whereas, like, if you are stateside and using those telehealth options, they still cannot provide maintenance meds past a 30-day. And if there's any lab work that's required, you can't access those medications through telehealth anyway. Also mentioned telemedicine through doctors in the States, even if you have been in the States within the year and you have those relationships built. Lots of people are running into issues where, like, for example, my husband needed his thyroid medication refilled, and so he was unable to access that. We had several denials on the economy. He was unable to access that care. His VA doctor in the States was willing to put in a script through Express Scripts but needed lab work done. So looking at those short-term solutions for people who are having, basically it's impossible to find solutions to some of these situations on the economy, and given the options that the hospital has so far provided, has the hospital looked at options such as providing like an email or some kind of access for stateside or telehealth providers to put in orders for labs so that they could potentially write a script if those relationships are already built in the States, and that way they could get a script to then fill at the pharmacy on base. Other things like contraceptive clinics, if you will, so that people can get those contraceptives refilled in a timely fashion, especially those that are not offered on the economy, which there's several birth control options that are unavailable in Japan. Same thing with, like, Yokota has had a very successful model when they cut off pediatric care. They had several patients that were on ADHD meds that are illegal here in Japan, cannot be mailed through Express Scripts, cannot be accessed in any format except for the on-base pharmacy. And after the Yokota clinic was made aware of the situations and denials people were facing and the inability to get those meds, they've put in now a clinic type format for those who have already been diagnosed, who are stable, if you will, so that they can get those medications like refills quarterly. Has the Yokosuka Naval Hospital looked at any of those short-term solutions that could make access to care a little bit more viable for those who have essentially been shut off from care?
Certainly, idea, what you mentioned that Yokota had done, but I need to explore it. We are working with our pharmacy, both here and with IT Solutions in the States, to develop a fax line so that prescriptions can be faxed in. They can't come over email for regulatory reasons.
For secure, like, because of the secure messaging, same as like the VA system.
But the fax is going to be a great solution when we have it functional. Lab at this time, we don't have a solution for as well. For OBGYN can see patients for not OB care, but GYN care, which includes birth control, so that's also an option. And other than that, we are, because the hospital is funded by DHP funds, the Department of Health Professions, we cannot use our funding to create different solutions for space available patients. So there's some regulatory law reasons that we are challenged right now.
Real quick, you mentioned something about OB services being unavailable. Up until this point, people have been told, civilians have been told that those services, except for in Okinawa, are available to
Yes,
civilians.
that did not change.
Okay, I just
Yes,
wanted
but,
to clarify that.
Something that you said in your conversation made me think of the OBGYN clinic as it's not a primary care clinic, but it does
No.
provide GYN services. And that's a non-traditional way of care delivery.
Oh, I understand. My secondary question is medical, but also related to the base as far as, while these long-term solutions are being explored, has the base developed any contingency plans for filling positions or finding a way to absorb some of the empty positions that will go unfilled, or because we have lots of civilians who are basically curtailing their services, and there's also issues with bringing in new civilians, and it's a significant amount of your base population as well as dependents. So has the base developed any contingency plans for handling those openings if the healthcare situation does not improve for civilians?
I'll let him answer that.
Yeah, glad you asked the question. So the base is, right? So we're leveraging our fleet and family support centers, and we're looking at how we do career fairs. And we're taking it a step further. So right now, our PA department is working with Fleet and Family and with DODEA to put together a pamphlet that will show our community that if we have to leverage our community, because that's one of the things that we do have is we have a very educated community. And there's an untapped professional workforce that we've yet to kind of go to. But so if we do this, and a lot of times, even just to take, for example, to apply to be a DODEA teacher, if you go online to try to find where those openings are, it could be a bit hard. I know that I asked Lieutenant Commander Beener, he's my acting, N9 department head, to just go and look. He had a difficult time trying to figure it out. So we got together, we sat down, and we figured out the best way to do this is put a pamphlet together. Show a sample submission package and an application. So my PA department's going to be working to help put that pamphlet together. And then we're going to have to make coaching available to help coach people through this process, to help them. And that's just one example. As the needs arise, what we'll do is we'll pivot, we'll direct resources, and we're going to tap what we have. The other thing is we're just going to have to try to recruit better. But once again, once we see the need, we'll move and we'll move quickly.
And I agree that some of those are solutions for making, like helping people here on base apply for those various positions that they may be eligible for. But there are a lot of civilian specialty jobs that are not easily hired from within the base community, including engineers and finance and investigators and security forces and things like that that are not always readily accessible in the space population. And right now there's an issue trying to recruit those people from the states, and that's only going to get more challenging if the healthcare issue remains and doesn't have a solution. And
Yeah, we completely understand. And believe you me, the healthcare situation is being discussed at the highest levels. You know, it is being addressed. Once again, we will continue to press and we will fill the needs, you know, where we can. But, you know, there's a lot of talent in this community. When you say finance, you know, I point to an expert in finance right now. She's not working in finance, but she's here. So there's people, you know, all throughout our community that are wonderfully talented. And, you know, the bottom line is, we'll do what we can. If we need to be more aggressive with our recruiting efforts, then we'll do that. But we'll do it as a community and we'll work together.
Thank you.
All right, are there any more questions out there? I'm seeing none, sir. So with that, I'll turn it over to you to close us out.
Okay, everybody, thanks for coming out. I know it was a different venue and a different type of a format, but we really appreciate everybody coming here and sharing with us. If you didn't get the exact you know, answer, or if some of the conversation stimulated another question, we're going to be around here for a little bit after we break, and you could certainly come up and engage with us. The whole purpose of this is that when you show up, you get something out of it. And I'm telling you, if you didn't get something out of it, there's an opportunity right here, right now to get something out of it. I appreciate everybody, and please remember, you don't have to wait for these to get any action taken. If you don't see anything being taken on an issue that you have, I open up my office. You know, we do break in the ice. You can come, you can talk to me about whatever concern you may have. If you're in Ikego, I go out to you in Ikego. If you're on main base, it's in my office. So please don't feel like you have to wait for this. We're trying to be as responsive as we can. Just bear with us sometimes, because, you know, progress doesn't always come as fast as we would all like. All right, thank you, everyone.